Okay, everybody, we're going to go ahead and get started. Welcome. I'm Molly Robb, the project coordinator for the California Evidence-Based Clearinghouse for Child Welfare, or CEBC for short. I'd like to thank you all for joining us and welcome you to the webinar. Thank you for answering the poll questions. This is helpful information for our presenters. We've muted your phones due to the high number of participants attending, so if you're experiencing any technical difficulties or have any urgent questions, please use the Q&A pod located on the right side of the screen, and we will do our best to assist you. We will also answer questions after the completion of the webinar. Please also find the PDFs of the webinar PowerPoint slides and other webinar relevant materials at the bottom of the screen in front of you. Lastly, you will receive an email with a link shortly after the conclusion of the webinar to complete a short and easy survey so we can continue to improve our webinars and make them as useful and beneficial as possible in the future. Now, a brief introduction of our presenters. Cambria Rose Walsh is currently the project manager of the CEBC, overseeing the day-to-day operations of the project. She has a master's in social work from San Diego State University and has been licensed as a clinical social worker since 2005. Jennifer Rolls-Roots is the research program specialist for the CEBC. She has a master's degree in public health from San Diego State University. Rhonda Williams is the research associate for the CEBC. She assists the CEBC research coordinator by providing research support such as performing literature reviews and summarizing relevant published peer-reviewed research articles. Rhonda has a Bachelor of Arts degree in psychology and 2 Masters of Arts degrees, one in human behavior and the other in counseling. And now, without further ado, please enjoy this webinar.
All right, we're very pleased to have all of you joining us today, and we're going to really spend today focused on the implementation information that we have recently added to the CEBC website. This is Cambria speaking now. I'm the project manager, and I will turn it over in a little while to my colleagues to go through some of the specific information. I want to remind you that this is part 1, and we are looking at having the second part of this webinar in May. And as we go through today, we'll talk a little bit about, allude to what we will be talking about in the future, but today we will be focused on the exploration part of the implementation guide for those of you who've had a chance to take a look at it. We also apologize that the handout we sent out yesterday, there was a slight technological glitch with it, and so there is a new handout that you can see in the file section here labeled webinar handouts. We also sent that out this morning. And the page that had an error specifically we have on here, which is the identifying the problem PDF. That's the one that you need to swap out if you already went ahead and printed it prior to this time. So we will go ahead and get started here. So the California Evidence-Based Clearinghouse for Child Welfare was formed in 2004. It's been funded by the California Department of Social Services, the Office of Child Abuse Prevention, and has been run out of Chadwick Center for Children and Families at Rady Children's Hospital in San Diego. And the website itself was launched back in June of 2006. The mission of the CEBC is to advance the effective implementation of evidence-based practices for children and families involved in the child welfare system. And there are 2 pieces to the CEBC at this point. There's our program registry, which has been up since we launched in June of 2006, and that contains all of the information about the individual programs that we have reviewed and rated. And then there's a new section that we added in January of this year on selecting and implementing programs. The program registry is the searchable database of programs, and it has information arranged in topic areas. Each program description contains easily accessible and vital information. This is where you'll find the CEBC scientific rating, where there's citations and summaries of the research studies, where there's a brief description of the program, and there's training and contact information. The CEBC Selecting and Implementing Programs section, the goal of this is to provide guidance and resources about the implementation of evidence-based practices. And this information is arranged in 3 subsections: the tools and resources, the guide to selecting and implementing EBPs, and the implementation examples. This is the new homepage that you'll see now when you go to www.cebc4cw.org, and it leads you into each of those 2 portals that I've described. And today, as I mentioned, we're really going to be focused on the selecting and implementing programs section. This is the homepage when you click on Select and Implement Programs, and you have a choice of going to 3 different areas here. The first area is the Tools and Resources, and this contains information about the EPIS framework, which I'll go over in just a moment, It also has some technical assistance materials. It has some key research articles about implementation issues, and it has a link to presentations and online trainings on implementation. And in fact, when we archive this webinar, it will be linked to in that particular section, so you'll be able to see it from there. There's also implementation materials from other sources, other websites, and other written sources that are out there. And there's some information on implementation measures in this section as well as links to the implementation information on all the programs that are rated a 1, 2, or 3 on the CEBC website. The CEBC implementation example section, this section really strives to provide you with information about communities that are implementing some of the specific practices that we review on the program registry. So there are publications related to this, as well as webinars and other online resources for you to be able to find out more information. And then the final section is the Selection and Implementation Guide, and that's really the focus of our webinar today, is to go through this guide that we have created to walk you through the various different steps of both selecting and implementing an evidence-based practice, or other innovation in some cases, as we talk about. Part of what we look at, and this is the fit, and so it is not always an evidence-based practice which is necessarily the best fit for the situation that you may be trying to find a practice for. The EPIS model is what the Selection and Implementation Guide is based on, and the EPIS phases of implementation, there are 4 of them: exploration, preparation, implementation, and sustainment. The webinar today is going to focus on exploration, which is the early stages of implementation, where you're making decisions about which practice to select. And the webinar, the part 2 that we'll be holding in May, will continue on what we're working on in this particular webinar to talk through the preparation, implementation, and the sustainment pieces. Although the reality is, as you can see by the arrows here, especially with sustainment, that's something that you really need to be thinking about even in the exploration stage as you're going through and making these selection decisions. The key steps in exploration that we're going to walk through with you today using materials from the guide are the formation of the implementation team, identifying the problem, narrowing the focus, conducting a needs assessment, identifying the potential solutions, determining the program fit, and then the creation of a written summary to document all the work that's done in this stage. To do this today, we're going to walk you through an example of a county that we have created based on kind of composite of different counties that we've done some work with, in order to help you understand how you would use the implementation guide. So to do the setup for this, it will be a mid-sized California county with a mix of rural and urban areas, and the county has reported their placement disruption rates the last 3 years, and you can see those listed here, and all of them are higher than the state average and the CFSR standard. So they actually are concerned about the fact that their placement disruption rates continue to be very high despite some of the efforts that they've made in the county to address this particular issue. So with that, I am going to turn it over to my research colleagues who are going to talk you through the forms and kind of how this process works.
Hello everyone, this is Rhonda. Like Cambria said, we're going to walk through an example of a community that has already identified the problem. We won't have enough time today in the webinar to go over several problems, but you can use the guide to help clarify the problem you want to focus on in your present county. So the first form you'll come to is the Implementation Team Membership Tracking Tool. This form is to help determine who should be a part of the team. If you look, A and B is very crucial. You always need somebody from the Senior Child Welfare Administrator that's going to oversee the project, and a day-to-day child welfare liaison, such as a manager, a senior manager, or someone, so that they can, if the deputy director here, you'll see his name, Betty Smith. If Betty Smith isn't available at that time, the manager, Polly Positive, will be available to report to Betty Smith.
And I'm just going to jump in for a second. All the materials that we're going to look at today are in the appendix of the Selection and Implementation Guide. I think you received a copy of that or a link to that when you registered. And on the website, we will be making form fill versions of all of the forms available so that they can be used. Right now, you can use the PDF versions, but we will be working on form-fill versions as well.
Okay, and going back to the implementation team membership tracking tool, keep in mind that this form is just an initial list for just the beginning. You may add and subtract people as you see fit on this form. And the main thing to remember during this process is you need to maintain someone high enough in the organization to keep the process going. Like I said, if Betty Smith steps out, positive, can still report to Betty Smith what is going on with the program that you guys have narrowed your focus down to. The next form is the exploration worksheet. Exploration worksheet, Appendix E3. This form will help you to determine why you're forming the team. It has questions that can be used during the initial meeting or prior to the creation of the implementation team to help guide its formation. So some of the questions on there, you'll be able to discuss a discussion of who will be involved at the county level, partners in the county, and that will help you also determine who's on the team. A brief explanation of your agency and leadership motivation for starting the exploration process, why you want to look at this particular problem. The next question that you might want to ask is information on any major linkages with other public service sectors, such as probation or mental health or any other public sectors that you may see fit. And then information on existing evidence-based programs that are already available in your county that you may be aware of. You want to make sure you list those, so if you're planning on replacing them with one, you'll know what you're replacing in the first place. And as you go through, you'll see there's a recent or upcoming changes to the system and review of timeline and personnel.
Okay. I'm going to touch on the content in each of these areas and talk about how the county is using the exploration worksheet to help guide this implementation and selection process. So again, as Cambria mentioned, this county had already identified that placement disruption was an area they had concern about, given that their numbers were higher than the state average and also for the CFSR standard. So they'd already come into this process saying they wanted to look at ways to address the disruption rate. And so the exploration worksheet was completed at the beginning of the process to fill in information about, kind of what this problem is, what they know about the problem. So as you can see here, they've decided in the initial area discussion of who will be involved that they would like to start their work in one region of their county, but ultimately go countywide. This is something that we always encourage. Think about piloting the work that you're doing rather than trying to make an abrupt change for the entire county. This allows you to try out the change that you're making, address issues that may come up locally before you go on a much broader scale. They also identified who would be involved. So obviously, when you're looking at placement disruption, you would have child welfare managers and staff, maybe frontline workers who can give some input. We always recommend you pull in stakeholders. So as you can see here, they have the Foster Parent Association, potentially some foster parents who may be able to give some input on the issue. In their county, the Mental Health Agency, which is an external agency to child welfare, they have that down, and again, potentially some providers. A placement committee. Some counties have a separate committee that addresses placement change or higher level of placement, so they've decided to pull them in. And in this particular county, they also have a crisis stabilization program, which is trying to address placement disruption. And this started about 2 years prior to the date when this process began. And so they have seen some lowering of the disruption rate since the crisis stabilization program began, but not a huge amount. So they're still interested in looking at this. So I'm not going to go through the rest of this in detail, but you'll see, they try to address some of the challenges they're expecting, what they can do to fix it, other areas that may be acting. In the information on existing EBPs, they mentioned a couple of EBPs that are already in place in the county. As Rhonda mentioned, it's always good to know what else is acting that may be affecting the same population or that you should be considering. And I think we'll just scroll through. They give a timeline. They'd like to get started with an actual pilot in the next 12 months. I think that's a very reasonable timeline. It's always concerning when a county wants to start, in 4 weeks, that they're not going to have enough time to do sufficient planning. And they've already at this point identified someone who will be kind of the leader on the process as they move forward. And again, this person is a manager level who directly reports to the deputy director, has been in child welfare for a long time, so would be a good person to lead the project in terms of being at a good level, but also linked into the system enough to be able to represent and communicate with different areas. Okay, so once they've kind of begun that initial process, now they need to start working on identifying the problem. So what exactly are they going to work at? So they've identified placement disruption, but what does that mean? And so we'll go through that in more detail. And again, as Rhonda mentioned at the beginning, in this format, we only really have time to talk about one problem area in depth, but most communities that we've worked with have several areas that they have concerns about or would like to address. Then what we would do with those communities is have them go through this same process for each problem area. And then we would normally ask them to try to identify one of the areas to begin working on so that they're not kind of overreaching. So begin with one area, have success there, and then move on to another. Okay, so identifying the problem, we have another worksheet here. And again, this is the worksheet that we updated in the handout that went out. So if your version of the handout looks a little different, you may need to download the correct version from the webinar dashboard, what that's called. Okay, at the bottom of the screen you should see it. And we provided this 2-page section in a separate version if you just need to download these 2 pages. This is all that's changed from the previous version. Okay, so the implementation team that Rhonda went over got together and started to identify and clarify the problem. So again, very basic. What's the problem? Too high a level of placement disruption, and they would like to come up with some way to avoid group homes, avoid residential care, and keep children in local settings. A key here is looking at what type of data you have to help understand the problem. So they have the data on placement rates, and they've got some demographic data. They've got some data from their placement committee, and then they also have data from the crisis stabilization program. But what this group realizes is that no one's really looked at kind of all this information as a whole. So that's something that this group will need to do, is to start thinking about that. The other issue is, as a group, coming up with what they think are the main factors that are affecting or causing this problem. And as a group, they came up with the, in their view, that a lot of this is being driven by difficult behavior on the part of the youth and foster parents basically saying they can't handle it and giving their 7-day notice from the change of placement. Again, this is just very introductory. This is at the beginning. We're going to look at this in more detail, but from what they're hearing through the staff and the various data sources they look at initially, this is what they're getting. Then we talk about what they've already done. As I mentioned, they established a crisis stabilization program about 2 years ago. Again, gut reaction, it is doing some work, but they're feeling like it's not really having the impact that they'd like to see. So then they start looking at the data, and I'm going to go ahead and flip to the data sources page. So a lot of times when we work with counties, they will think they don't have enough data to really examine the problem sufficiently. So what we've done here is kind of put together a list of places that you can start to look for data on your program or on your particular situation. And again, this is geared at child welfare agencies, but if you're from another sector or a private agency, there are likely sources that you have internally that would be available. So here in California, we have a great website that allows you to look at data through the California Child Welfare Indicators Project. Really easy to use, and you can pull some county-specific information. You can do comparisons between your county and the state by age, gender, race, ethnicity, etc. So a great resource to start looking. You likely have existing reports, annual reports to your Board of Supervisors, data from community self-assessments or SIPs that were done for the state. You may have data from structured decision making or other decision support systems that you're using. Things like efforts to outcomes, first five databases. It really becomes an issue in the implementation group of thinking about what are the data sources that you have available and how can you utilize what's already out there to inform your decision-making process. In some cases, like you see number 9, we've recommended that communities do literally a chart review, poll some cases. So in this county, when they're looking at placement disruption, they might look at 10 or 15 placement disruptions that occurred in the last year and try to get a better idea of what went on, what was the process, etc. You can also do focus groups in number 10 or surveys. Again, just trying to figure out what's the best way to get data on the problem that you're experiencing. Okay, so I'm going to go back up to the data section. So in this particular county, they pulled data that they had available. They went through kind of this process, and they started to fill in this form on who was on what's the actual target population. And what they found is that it tended to be adolescents who were having more placement disruption. They were seeing it both genders all across the county. They did notice that in Region 2, there were a larger number of placement disruptions, but there are also more foster care homes in that region. So it was, as I identified earlier, it's a good place to start. So it didn't seem to be disproportionately affecting any particular group. In terms of the time frame when it was happening, it seemed to be more common among kids who'd been in foster care for a while. So at that point, they said maybe we need to pull in someone from their permanency team onto the implementation team. So they went ahead and added someone from the permanency team in their child welfare system into the implementation work group. Again, they've identified Region 2 as the area that was most affected, and they were going to start with that already. They talked about what type of delivery setting would be most conducive to this problem area. And what they really felt was that in-home, something in the home would be great because the problems are mainly occurring in the home. So when they were looking at the data, they were seeing some school issues in these kids, but it really seemed to be issues going on in the home that were leading to the breakdown of the foster placement. Okay. So I'm going to jump ahead. Another way that we typically recommend that people kind of dig into their data is something called the Ask Why 5 times. You may do this a similar process with various methods. Some people use a fishbone diagram. There are other ways of getting at it, but we found this to kind of be just a real basic way for a group to have a discussion about what's going on. So here's an example that this county went through when they were in one of the initial implementation team meetings, and we'll just kind of walk through it. Again, the problem, the placement disruption rate's high. The initial solution, we need to help foster parents better handle difficult adolescent behavior so the placement stays intact. And the question is always, is this the correct response? So by using the Ask Why 5 times process, they're trying to address each of these issues and kind of get more at the root cause of what's going on. So why do the placements disrupt? Factually, the foster parents give the 7-day notice, and they found from talking to the placement committee and reviewing notices that the foster parents were frequently citing youth behavior as one of the issues. Why are they citing behavior? Again, you keep asking this. In this case, they would find there was usually some sort of precipitating incident, the straw that broke the camel's back, a final argument, a rule break, a school suspension, something that had got on that precipitated the 7-day notice to occur. And they found this from talking to the crisis stabilization unit staff. And in this county, what would typically happen is when a 7-day notice was given, crisis stabilization would be activated to assist. And so they had some good information about what had gone on once the notice was given. But what they also found from talking to foster parents and frontline caseworkers was that oftentimes in these homes, there had been an ongoing history of behavior problems and conflict in the home that really hadn't been well addressed. And so What they also found from kind of digging into this data was that a lot of these youth either had received or were receiving mental health services. So they were able to determine this from looking at some of their mental health services referral data. And then by looking at the mental health billing data in coordination with their mental health agency, they were able to see that a lot of these youth who had placement disruptions had externalizing behavior disorders, which would go along with some of the issues they were seeing with the foster parent. So they were, again, using this process, they were trying to dig into the data to get a little bit more at what was going on, what was really driving the issues. And some of the concerns that they identified was, how successful were the mental health services these youth were getting? Did they address youth in-home behaviors, or were they largely clinic-based? And did the foster parents receive any training on how to address difficult behavior within the restrictions that are in place for a foster care provider, what they're allowed to do, or how they're allowed to discipline children in their care? So again, these led to additional discussions with the implementation team as they tried to get more information and more understanding of what was driving the placement disruption. There's a step here before we get to identifying potential solutions that we just want to touch on, and it's in the implementation guide. Again, it's narrowing the focus. As we mentioned earlier, in this community, they've already done that. They've already identified the one problem area that they want to work on. But in other communities, this would be the point where we would look at the 3 or 4 problem areas that they've reviewed and help them identify one to start with that they want to focus on. We've also talked through kind of this data process of conducting a needs assessment. So as they were doing the Ask Why 5 times, looking at their data, they were really conducting their needs assessment. What are the needs that were here? What were the services that were already in place? And again, this is discussed in the guide, and we won't go into much more detail other than what we've talked about on these pages. So now we're going to talk about potential solutions. So they've identified their problem area, and they've looked at their data. They've done some digging. They've talked with foster parents, frontline providers, placement committee, crisis stabilization. They've done a lot of discussion trying to get at this. And now they're starting to think about, well, what do we do? How can we try to address this? So one of the ways that we will have a community or an agency start is by, again, thinking about what you are trying to address. So in this case, coming up with your list of keywords, and this is a form, again, that is available in the implementation guide. It's Appendix E6. So they have placement disruption, behavioral problems, child, adolescent. Those are their keywords. Again, very basic. They identified the placement stabilization topic area as an area to examine. And then what they did was went ahead and filled out some of the information in the forms about the types of programs in the placement stabilization area that might address their needs. What you're going to see here on this form at is basic information about each program, which is pulled completely, just cut and paste off the CEBC website, and then a notes section at the bottom where you'll see some notes that are in black, which would be kind of before the meeting. This is what they thought as they were putting this together. And then during the meeting, those notes are in red. So again, just quick notes from the meeting of what the discussion items were. So the programs that they identified as potentially meeting their needs would be multidimensional treatment foster care for adolescents, or MTFCA, KEEP, which we'll come back to, family group decision making, or FGDM, and wraparound. So let's walk through each of those in a little bit more detail. The description is there. MTFCA, very briefly, is a treatment foster care model. It's meant to be used with adolescents. It has a good level of research. It is focused specifically on disruptive behaviors, and the community here felt that this might be a good fit for them. When they went into the meeting, some of the discussion items that they had were that it's a new program for this community, but that has good research evidence. And then they have used treatment foster care before in the county, so there was some familiarity with their foster parents using treatment foster care, but they'd never evaluated treatment foster care in their county or to see what the effects were. what the meeting really felt like was they would need to talk more with the developer in order to get an idea of the specifics, what's the cost, what's the timeline, et cetera, because this would really be a big change. It would be bringing a new program in, and they would need to have a lot more thoughtful discussion with the developer about that. So the decision was that if they were going to move forward, Polly, again, who was the coordinator for this process, would arrange a conference call with the developer. For KEEP, you'll see this is crossed out. The reason it's crossed out was that the target population of 4 to 12-year-olds really didn't fit their need. But in the meeting, they did say this would be of interest if we could use it with older kids, and they would come back to it potentially. FGDM, they noted that this was similar to team decision-making, which they already had in the community. Not sure how this process addressed behavioral issues, how different it was from team decision-making. And so they had, again, additional questions about that. You'll see in the red. And then wraparound. Again, this was already in place in the community. They noted during the meeting that it's really being used for youth who are stepping down from higher levels of care, but that they didn't know what the data was. Have they looked at it? How effective is it, et cetera? So that was an issue that was raised. And really what came out of this meeting where they discussed the potentials is how do they better or earlier identify kids who were at risk of placement disruption so they could be more proactive and less reactive to the issues. So again, a lot of meeting and discussion talking about these. Now I'm going to turn it over to Rhonda, who will talk about program fit and how they worked on this.
Now, during this meeting or even after this meeting, they use form, well, it's Appendix E7 to work on the selection guide worksheet, and they use questions from this. It's an example of some of the questions that you would need to address to help you complete the selection guide worksheet. They would ask questions like, how complex is the program? If you look under the ease of use and key question on the first page of E7, one of the questions is, how complex is the program? How hard is it to fit within their county and to implement it? And then if you look at the CEBC program description sections to review, you need to look at the essential components, the recommended parameters, identified resources necessary to implement the program, and the education and training resources that you'll need to make sure that this program can be implemented in your county.
I'm going to go ahead and flip to the worksheet. Would that help?
Yes.
And people can kind of follow along. What you'll see on the worksheet on the right-hand side are the areas that are discussed in the guide, in the discussion guide, and then Rhonda will talk through some of those in a little bit more detail.
If you're looking at the external compatibility of, say, MFTCA, you need to find out how compatible it is in the practice with the beliefs and values of the local community and the client. Is the practice compatible with the referral sources currently in place in the community? You want to make sure it basically fits the target population that you're trying to make a change in. Going down here, if you look at the CEBC program description sections to review, one of the first things is target population. And as you go on, you can see even languages and how relevant is it with the CWS Child Welfare Systems population. Financial considerations, relative advantage. What financial resources are available to fund the practice, both in the short and long term, because you want to look at sustainability of the program so that you don't just jump into the program and decide that you want to implement it, but then after, say, 3 or 4 months, it's no longer financially viable to keep around. What's the training cost what's the cost for training and consultation? And all of this you're using to help you fill out the selection guide worksheet. And
it's a lot of detail.
Yes,
I think, again,
very detailed.
This would be an entire probably work group meeting to kind of walk through this. There's no absolute answers for these, and every one of these answers is going to vary by the particular agency, county, or location that's discussing it. And counties will pick different things depending on their specific situation. And that's why really we can provide some of the questions to talk about, but we can't give you the answers because it's really going to vary depending on the local situation.
And after you've used everything all the questions in Appendix E7, the next step is to make sure that you have the phone call with the developer, which Polly will coordinate. And you need to, because she needs to be involved, and she'll also update the deputy director. You need to discuss, after you've talked to the program developer, determine if a call is needed with the TDM developer. Say you've picked MTFC or FGDM. You want to make sure that it's not already something that the TDM team is already doing. After the phone call, you do a group discussion and rank the programs. And the next step is the group discussion and ranking of programs. Then you need to do a 2-hour meeting and make sure that everyone from the implementation team is present in person. You need a note taker or somehow make sure that you're recording the meeting so that you'll be able to refer back to this and understand why you made this decision. And prior to the meeting, make sure that everyone has reviewed the materials and they're prepared to talk about what you guys have talked about. Bring the hard copies with you so you won't just be going from rote memory. And, it's either electronic or hard copies, just so that you'll have a reference point. During the meeting, you will discuss the potential options and draft a summary report with recommendations for the next steps. So make sure that, like I said, everyone has gone over everything and able to participate in the meeting. The main thing to remember is that this discussion will differ for every community. The key is that concrete decisions are made and action steps are developed, along with assignments to ensure that the steps occur.
Mm-hmm. We also have a page that talks about, in the guide, that talks about working with the program developers. And Rhonda, do you want to kind of review that one briefly?
This page is for when you are talking with the developer program. You need to be thinking as you're talking to them, how easily was it to talk to them? How understandable was the information that they conveyed on how to implement the program? You need to make sure that your staff will be able to understand how the essential components on how to make sure that this program works. Here's some examples on this page, Appendix E8, on some of the questions you need to consider during both the exploration and preparation phase. Like I said, how available will they be to train your staff? How easily are they to work with? Were they difficult? Was it easy getting information from them? And a key component is the cost for staff training, which includes the travel. You need to make sure that this person is going to be available to assist your staff if they have questions. Mm-hmm. And like I said before, you need to make sure that the program fidelity is monitored. Ask the developer about experience and implementation with diverse populations. You want to make sure that it is targeted toward the population that, or will help the population that you are trying to help in Region 2, since this is what they've identified. And the main thing, make sure that you can sustain it. Make sure that before you implement a program, it is something that will make a continuous change in your community. Ask about the train-the-trainer options or other strategies that can help sustain the program in the organization. Be sure and get specific information about clear cost and the criteria.
And I would say that these phone calls, might be an hour, and you might do it as a conference call and have several people from the implementation team involved, even if really one person's having the call, but the others are able to listen in and ask an occasional question. And really, you're just trying to get a feeling for, one, how is it to work with this developer? Mm-hmm. Can you picture yourself working with them relatively closely to get this off the ground? Sure. And also to narrow down some of the questions that you have. When you look at the selection guide, you'll see a lot of these things like said need more information from developer. There were a lot of pieces that still needed to be addressed, a lot of specifics that have to be addressed. And at least you may not get every question answered or get the details, but you can usually get at least some ballpark figures, timelines. If you need to have training for your staff, how long is that going to take? So you can at least get some good information that will help you in your decision-making process. So after you have, talked with all your developers and you've had your group meeting where you really start to process the information and decide what you're going to do next, we always recommend that you create a written summary. And we provided a template for the report that we call it, an exploration summary report. So we've got a template here that you can use. Obviously, don't need to use every piece, but we found that, picking and choosing from these sections helps you think about, issues that we have come across when we've been doing implementation technical assistance. And what I'm going to do now is kind of walk through some parts of the exploration summary report for the example county we've been talking about, just to give you an idea of where they decided to go. So we would always say have an executive summary, have something brief. I haven't put that here because we're going to talk about it in more detail, but again, have that short review. Start with some review of what you did. So how did you get this information? It came from reports, it came from a survey that they did, some chart abstraction, here's who we surveyed or interviewed. Again, it just lends some credibility to what you're doing, and 3 years down the road when there's been staff changes and you're trying to remember what the process was, you'll have a document that really shows you what you looked at. So section B is existing practices, and this is going to talk about what were the practices that they looked at that may already be or could address the placement disruption area. So one of the first ones that they looked at was the crisis stabilization program. And we always recommend that you have, just a brief description, what it is, who's the target population that program is currently addressing, what's the goal. In this case, it's pretty clear, it was reduce placement disruption. It's only in this county provided by one mental health agency. There is a contract, but in this section they listed some of the very basic responsibilities, the 24-hour, 7 days a week on-call service, providing in-home, participating in other committees and meetings as requested. And then in terms of the summary of experience with each practice, this would be looking at what data do you have about this particular service and how effective it's been. And in this case, they were able to say that there's really been no clear evaluation on this program that's been done to date. It's been in place for 2 years, so there may be data, but no one's really looked at it. The other existing practices they identified were foster parent education, and so they put some information. Really, they were doing kind of the basic foster parent education that probably most counties are. Initial training in order to get your foster care license, and then ongoing training on an annual basis. But really nothing targeted directly at this problem area. They haven't really done any evaluations other than some very basic evaluation at the end of each training session, asking how they liked that particular training, but no kind of more comprehensive evaluation of the foster parent training. And they don't have a policy in this county of doing exit interviews with foster parents who leave the system. The other things that they were going to look at, I didn't include them here, just again for time factor, would be mental health services. So are there any mental health services other than the crisis stabilization program that are specifically focused on addressing disruptive behavior disorders or placement issues? In this county, they have multiple mental health providers, and so they may have to identify, what are the differences between the providers, who are the providers that are most commonly referred to, what's the referral process, and so on. Again, this county uses team decision making, and so they provide some information on that. In this particular county, they use team decision making around placement change, but oftentimes the meeting isn't held until the placement change is already occurring. So it may occur before the actual physical move occurs, and sometimes the meeting doesn't even occur until a couple days after the change. So there would be some discussion about, how is that working? What can they do to help with that process in terms of preventing, to be more preventive in terms of the placement. And then lastly, the wraparound. So also providing some information on that, how it's currently being used in the county. Again, in this county, they're using it as a step-down service, so youth coming out of higher levels of placement and returning either to foster care or to their own homes are being serviced through wraparound. So some description of how that's being done. So in this county, before they even got into the idea of what they were going to do, what new program or what potential program to bring in this discussion process, it really led them to some areas they needed to address. And these are what we call building the infrastructure. So you already have things that are in place that you might want to address or beef up a bit. And in this county, they identified, what were the current assessment and referral processes for mental health services. And the group said we need to look at whether all kids in foster care are really getting, some sort of periodic mental health screening and assessment. In terms of the crisis stabilization program, they came up with some recommended changes. How could we revise the target population to be more proactive? Let's not wait until the 7-day notice. How do we identify these families earlier? They identified, allowing foster parents to self-refer, doing more outreach to foster parents. So doing something simple like creating a refrigerator magnet that goes to every foster parent, or making sure they have a hotline number that every foster parent has that they can call when there are issues that they're concerned about or they're having a crisis in the home. And then more training for caseworkers in the foster care units about how and when to refer. So what they identified here was that they really could be making the referrals a little bit earlier and trying to head off the placement notice disruption rather than waiting until it had occurred and trying to address it at that point. Other things you can look at would be, organizational readiness, your training model. In this case, they might talk about their foster parent training and what changes they want to make here. We won't go into that detail again for time constraints. So let's move down to the bottom and talk about kind of what this county decided to do. And as Cambria alluded to earlier, we don't always advise that every county just implement a new practice. That may not be the most appropriate thing. And so in this county, they really went kind of in 3 directions, or 3 areas they're going to look at. The first path is expanding upon what already exists in the county. So they've got wraparound in place, which does have evidence as a placement stabilization program. And so they're going to consider expanding it to serve more youth in foster care. They also are going to consider conducting their TDMs a little bit differently on a periodic basis for a more proactive approach rather than just at placement change. So could they do the TDM every 6 months while the child's in placement rather than just at the placement at placement change time points? They also want to determine the evidence base for their current services. So they like their crisis stabilization program. They think it is helping, that people do find it useful, but they need to establish some outcomes for it and really do some evaluation. So they're going to consider that. And then they also think that the MTFCA program would be worth looking at in more detail. And so the third way they want to go is to pilot the MTFC model in the one region, in Region 2. Probably the most important part of this summary is this last section that we call practical action steps. And really, this is just a series of things that you pull out of the overall report and just make a separate list so that you can have this as a separate reference. So again, it's outlining what needs to occur next. And this is really your basic introduction to the preparation phase, which we'll cover in the part 2 of this webinar in May. And so what you'll see here is that these items all reflect the things that we just talked about, but the difference is now we have assigned an action step. So who is going to do this? So for example, for the mental health screening and assessment item, we've identified that the deputy director, who's been involved with the implementation team, and her staff will review how this is being done. So we've put someone in charge of this. Now, I think it was Polly Positive, who was ultimately kind of running the day-to-day implementation group, will still be the one keeping an eye on these things as they move forward. But now we've identified who's going to do it. So for the next one, for B, Crisis Stabilization Program, the Crisis Stabilization Manager and their staff will start holding meetings to discuss making some of these changes with some input from other folks, from QA, Resource Parent Services, etc. For the MTFCA, which will probably become the majority of the work the implementation team is doing, They will keep moving forward on that. And as I note here, the implementation team membership may shift at this time, but they're going to keep moving forward. And so when we come back to the webinar in May, we'll talk more about what their next steps were. For the TDM, they're going to put their TDM facilitators and manager in charge of having some discussion around the suggested changes and what the implications would be. Again, no decisions made on whether they're going to make those changes, but just beginning that discussion of how that would work. And the same thing for wraparound, putting it back on those who are in charge of wraparound with consultation from people like the deputy director to discuss what would the implications be of making those changes. So for example, for wraparound, expanding the services to more youth in foster care would obviously require money, staffing. It would be a significant change. It may not be something the county can do at this time point, but it's something that could be discussed and come up with an answer. At this point, the original implementation team would stay in place, and they'd meet periodically as an oversight group for the action steps above, and to get some reporting back on those steps. And then, as I mentioned, you would really have the lion's share of the work would probably be around the MTFCA pilot that's going on in the region. And at this point, we have reached the end of the exploration phase, so we're going to take it back to the main piece and open up for any questions. And Cambria, I think you've been watching. Have there been any questions?
There's one question, and at this point in your Q&A pod, go ahead and
Can you go down to the
add
next
any
slide?
questions that you may have in the few minutes that we have remaining here.
Okay, there we go. Can we go ahead and address that question?
Address
Yes.
that question.
So someone asked, will you be updating the guide to include the selection guide worksheet? Noticed it isn't in there. Yes, we will be. What we're planning to do with the guide is really have it be a pretty fluid document. As we continue to develop more materials and working with folks, we will be updating this. That's why we're not selling printed copies of this. It's really meant to be a PDF tool, and we will continue to add additional tools and resources. As I mentioned earlier, we'll be posting some of the PDF fillable forms that you can use directly. So yes, and we really, obviously, as people are looking at this, if you have suggestions of tools that you'd like to see, please feel free to send us an email, let us know, or if you have any thoughts or suggestions, that would be appreciated as we move forward.
And any feedback about using the tools or the guide itself, Jennifer said it's a work in progress, so we're certainly happy to get feedback and make adjustments as we go. And in fact, as we worked on this particular webinar and utilized some of it, we thought, oh, it would be helpful to have this section for notes or this section.
Yeah.
So we'll be updating some of the existing implementation guide just based on the work that we did putting this particular webinar together.
We'll give it a minute to see if we have any additional questions. So we will be having part 2, which will focus on the preparation phase for this community as they move forward with MTFCA. And we'll also continue to follow them as they kind of looked at some of the additional suggestions that they had for improvement. Again, I think the key thing to keep in mind is that in this community, it was a process. It involved multiple meetings with a group of folks who had interest and were really committed to trying to figure out what the data was telling them and make a really planful decision about what changes, if any, needed to be made. And we will continue following this community as we move forward and see what happens with their various components. Any other questions have come through? Nope. All right.
Thank you guys for attending this webinar, and please remember to look for our survey, which will be sent to you within the next few minutes. Your feedback is very important to us and greatly appreciated. If you would like to sign up for the CEBC email alerts of new programs and content, please go to the address on the screen, and also feel free to contact us for questions and assistance at info@cebc